Hello and welcome to Orchid Health Conversations, where trusted doctors come together and help us make sense of disease, illness, and health, one conversation at a time. I am Dr. Abhinav from Orchid Pharma, and today the conversation we'll be having is around a disease that affects not just patients but their families as well. Today we'll be talking about cancer. It's a pleasure to welcome Dr. Abhinav Veerwal, Senior Consultant Urology, Renal Transplant, and Robotic Uro-Oncology. Thank you for being here.
Thank you.
Dr. Abhinav, prostate cancer is normally called as the silent cancer. Why does prostate cancer not have too many symptoms in the beginning?
Good. It is a solid organ cancer. That organ which does not have a much role in older age. It has a reproductive role, and it is kind of useless in the older age. So it only causes problem like urinary symptoms or prostate cancer. It usually grows very silently for years before it spreads to balls, lungs, and causes symptoms. So that is why it's known as silent cancer, rather than other cancers which occur in liver, kidney, which produce signals very quickly. So it does not produce symptoms. It does a long course before it appears the metastasis.
For the men listening today, at what age should they start paying attention to their prostate health, even if they are feeling completely fine?
That is very important that all the men between above 50 years of age should give importance to their prostate health. It is not a big thing. And the reason is that why I should all men should consider their prostate health is that prostate diseases are very common. Prostate cancer occurs in 1 out of 7 men, and as it is one of the most easily screened cancer in the whole body. A simple blood test, you will know whether you are at risk for prostate cancer or not. So men above the age of 50 should get screened yearly or 2 yearly for this, which is a very simple test for prostate cancer. Or anyone with urinary symptoms, any urinary problems should always get screened for these.
Many men worry about treatment and its impact on their daily lives. How would you reassure them about the impact on their lives as well as sexual health?
And first thing is that if the disease is occurring, it needs to be treated even if there are side effects, because if we don't treat it, then after treatment it's going to increase and cause much more trouble than whatever treatment brings it. Yes, treatment does come with some side effects. That is true. It is a cancer treatment. The surgery, which is which goal is to remove the prostate and remove the cancer altogether. It has a couple of long-term side effects. One is incontinence. Now, man, the rate of incontinence in robotic surgery era has decreased drastically. Most patients achieve continence within 3 to 4 weeks after surgery, which is acceptable to most people. Long-term incontinence occurs in less than 1% of patients, and for them we have different solutions. Second is sexual health. Definitely, erectile function is affected after prostate cancer surgery or radiation either. But usually it also recovers in most of the cases, but it takes a little bit longer time, say 2 to 3 years before it. You might have to take some adjuvant therapy for that. So the newer treatments, the rate improvement in robotic surgery, improvement in techniques, early detection of prostate cancer, these have brought these advancements of giving results with less and less side.
We often hear the term active surveillance, but it can sound confusing to patients. How can you explain to the patients that sometimes it's better to observe rather than going for a treatment immediately?
Definitely, ma'am. So prostate cancer is a spectrum. It can be very indolent, like very benign of course, and it can be very aggressive also. Like it ranges from 6 to 10. So in cases in which it is at a very benign stage, in a very indolent type of cancer, just a decent score 6, in those cases, the treatment might be more harmful rather than the beneficial. So in particular, in those cases which have low volume disease just start of the cancer or very benign looking cancer, the cancer score is 6, and those the chance of spread of the cancer is very very less. So we observe these patients 3 monthly, 6 monthly at the early, and we can know whether the cancer is spreading or changing its pattern. So we can avoid the side effects of the treatment, and we can just observe the patient, and that is known as active surveillance. It is done in only in select cases in which the cancer is at very early stage and very benign.
And finally, a direct message to men who keep delaying their checkups. What could you say to them to encourage them to go for that first checkup for prostate?
So to avoid prostate disease is not good. Reason is that it is a silent killer, it will progress silently, and again I would repeat this thing that it is one of the most easily screenable cancer in the whole body. Just a simple blood test and you will know whether you are at risk or not for prostate cancer. So delaying the screening for this cancer will only aggravate the stage. The cancer will be detected at a higher stage, in which the treatment will be all the more difficult and with all the more side effects. So with simple screening, we can detect it at early stage. Why should you screen? Because the number of patients of prostate cancer is huge. Out of 7 males, one above 50 will be affected with prostate cancer. So with these 2 points, easy screening and higher number of incidence of prostate cancer, you should screen every early or too early with a simple blood test, that is serum PSA. And if it is raised, don't worry, it's detected at the early stage. Very good treatment options are available. It is unlikely that you will ever die of prostate cancer because so many good treatments options are available today.
I'd like to sincerely thank you, Dr. Abhinav, for the clarity that you have provided on prostate cancer, because so many of us, so many of our viewers, our families, they're suffering from this disease and they don't know what to do about it.
Thank you so much. Just my pleasure. Thank you so much. So guys, don't worry. Men's health has been ignored for long. Men's health covers all these diseases which come with old age in men's. So we are here for you. We provide you best care, and take sure any worry, any doubt, we are always approachable 24 hours.
If you found this conversation meaningful, we invite you to like and subscribe to Orchid Health Conversations, where we will continue to invite doctors to talk about health and disease in a clear, meaningful, and compassionate manner.